Achieve Disability Healthcare Initiative. Access, Policy, Education. Access to healthcare for women and girls with disabilities.
The new doctors have to learn how to be able to work with a person with a disability. And knowing what that those challenges are met.
The medical community, I believe, need to look at people with disabilities as whole people, not as diagnoses, not focusing on what they can't do, but focusing on what they can do. I really believe that your physician can be your partner and help you to live the life you want to live, not be an obstacle. And in all too many cases, physicians look at the clinical person, they don't look at the real person and how they want to live their lives. I come in contact with women all the time who weren't getting quality care, who would go to ERs 4 and 5 times for pain and not be appropriately examined because they assumed that the pain was related to their disability, and after the 4th visit they found that it was related to a broken leg, but they didn't do the standard medical testing procedures to uncover that. And so after I began to realize that was happening in my community, I started actually putting people in my vehicle and driving 3.5 hours to bring them to the clinic that I was going to because I had confidence they would get quality care.
ADA law states that medical care providers must provide individuals with disabilities full and equal access to their health care services and facilities, and reasonable modifications to policies, practices, and procedures when necessary to make health care services fully available to individuals with disabilities, unless the modifications would fundamentally alter the essential nature of the services.
It is a federal law that is enforced by a variety of measures, one of which is in the hands of individuals with disabilities. They are empowered to self-advocate, and if their rights have been violated, they can go to the Department of Justice and file a complaint for an investigation, or they can go directly to federal court and file a federal lawsuit. Hundreds of them happen a year across the country. And when you think how that could have been prevented by talking, by communicating with your patients, and by saying, how can we help you?
Do you want me to take your shoes off first? Okay.
Do that.
Or do you want to pivot first?
Let's pivot.
Pivot first and then.
We listen to how they want us to move them. Like they know better than anybody how to be moved onto a table. So the patients will tell us, well, I like to go this way or that way. They assist us.
A lot of the women have not been weighed in years. They're on medications, have not been changed because of their weights, whether they go up or down, or the fact that they just want to know their weight.
New standards for medical diagnostic equipment are currently being developed for exam tables, chairs, weight scales, X-ray machines, and other radiological and mammography equipment.
These patients often have difficulties with transportation, and so the traditional model of giving patients prescriptions to come back on different days for their mammogram or their bone density scan or their ultrasound doesn't fit as well for this patient population. So providing all of those services on the same day as the visit makes it much more convenient for the patient and more likely that they'll actually get those services.
Well, I had made an appointment at the hospital and I was on time. I gave the receptionist my name, but the interpreter did not come for my appointment even after a half hour. So I had the Americans with Disabilities Act with me and said, we're going to have to postpone this until another time when an interpreter can be here for me. Many young girls need to have the interpreters with them. Interpreters have been through training on medical terminology, and they're very professional and confidential. They follow a code of ethics regarding that. They can't tell anyone about your situation. So interpreters, professional interpreters, are critical to have. The hospital will pay the interpreter, so that you can have communication access directly with your doctor or your nurse or any psychiatrist or psychologist. It's best not to have a family member do the interpreting for you, because that will not be confidential.
As far as education goes for people that need to use the Braille system, this example is a woman that's pregnant where the patient can actually feel the diagram and see how her body will change when she's pregnant.
We have Braille information. We have a notice of the privacy practices. We have financial assistance information that's in Braille. And we also have frequently asked questions if they feel like this might be a question that I'm afraid to ask. It may not make any sense. They can find the information in Braille, and then it should have answers that can help accommodate those questions they may have. If the questions are not available in Braille, we will help them to get the information.
Other alternate formats can be made available in addition to Braille, such as large print, audio, and electronic copies.
Many times patients have related stories to us of their experiences of going to a general OBGYN practice where perhaps they were unable to transfer onto the high table, or they had a generally negative experience and they thought that preventative health services really weren't available to them in the traditional sense. And once they've come to our clinic and realized that they can easily transfer over to the table, that there's time for them to get the care that they need, that there's adequate staffing, and it's a positive experience without the embarrassment that they may have felt before, we find that the patients are more likely to return for their care.
The office staff where I go is always nice. They know my name, and if there's any socks that need to be done, those are always nice. They consider me first, and then and they always leave me with a smile.
Make sure you're getting what you know every woman needs, like regular pap smears, like regular mammograms. You know your transfers best, so make them listen. You know your body function best, make them listen, and don't accept the easy way out.
Achiva's Disability Healthcare Initiative. Access, Policy, Education. For more information, visit www.achiva.info. Achiva's Disability Healthcare Initiative. Access to healthcare for women and girls with disabilities. Our special thanks: Beth Malley, Shauna Aiken, Joan Stein, Linda Cumston, RN, Jamaica Drury, Glenn Updike, MD, Benita Smith. The Center for Women with Disabilities at McGee Women's Hospital of UPMC, Accessibility Development Associates Incorporated, Voices for Independence, Milestone. Citations: the United States Department of Justice and the United States Access Board. This video was made possible by the Jewish Women's Foundation of Greater Pittsburgh and by FISA Foundation. Copyright 2012 by Achiva and by the Jewish Women's Foundation of Greater Pittsburgh. Permission to reprint, copy, and distribute this work is granted provided it is reproduced as a whole, distributed at no more than actual cost, and displays this copyright notice. Any other reproduction is strictly prohibited. Produced by Pittsburgh Filmmakers, the Media Arts Center.